welcome to the Power Tools for Coalition webinar series. I'm Kinkini Banerjee, the Senior Manager of Coalition Relations at USBC, and I'm so glad to have you join us for this session. This Power Tools series is organized as part of USBC's training, technical assistance, and capacity building support for our network of state, territorial, tribal, and community breastfeeding coalitions across the United States. As you know, access to these webinars is free and open to all interested breastfeeding coalition leaders, members, breastfeeding advocates, and to anyone involved in forming or leading nonprofit organizations in the breastfeeding field. Our webinar announcements are sent through the USBC's coalition announcement list. So the access and the topic and speaker details are posted 2 weeks before each session, and the handouts can be found on our Power Tools webpage. So you should see a chat where you can see the link, get a direct link to the Power Tools page, and you can download today's slides. I'll just go over some quick housekeeping. As a way to make things easier for you, as of April, we streamlined the process so that once you register, you're registered for the whole series and you don't have to re-register for every single webinar. So this is a good way for you, and you get auto reminders and also a reminder email. So we hope you'll complete the survey at the end of it and give us some feedback about what kind of topics you'd like to see in future. And again, all sessions are recorded, so you can, if you are not able to listen to this live, we have recordings for all of these. You can go to the Power Tools page and download the recording. So this is where I'll show you where the webinar materials are. If you go on our website and click across the top bar, you'll see the last tab is Coalitions. Click on Coalitions and it'll give you the list of USBC webinars. We have the CDC 222 calls, we have this Power Tools series, we have a Collective Impact series, and a Racial Equity series. So we are so glad to bring you this whole range of capacity building webinars to strengthen your coalition's capacity to serve women and children. For today's webinar, all participants are in listen-only mode. We encourage you to submit your questions, so you can submit them at any time. You should have, on the right of your screen, you'll see a control panel. If you don't see it, it might have minimized, so you'll see a little tab with the orange tab with a white arrow. Just click on it and it's going to pop the control panel out, and scroll down, and under the audio section you'll see a blue tab called Questions. Click on it and it'll open up a text box for you to type your question. So do send in your questions at any time during our presentation, and we'll have Q&A at the end, and I'll be sure to pass them on to our presenter. If you have any technical or audio problems during this session, email coalitions@usbreastfeeding.org and someone will be able to help you. Okay, and that brings me to today's topic, the importance of evaluation. So all of you do such amazing work for mainly volunteer-run organizations, and evaluation is a great way to show impact and also to assess the design, implementation, improvement, and outcomes of the various programs that you do. When conducted on a regular basis, strong evaluations position coalitions to better understand their work and inform their management and improve program impact. So during today's session, you'll learn how to tell the story of your work through accurate documentation and also show effectiveness and empowerment of your various stakeholders. Plus, this is a great venue for you to get all of your questions answered. So do not hold back. We are so delighted to have Dr. Kimberley Broomfield-Massey from EMSTAR Research present this session today. Dr. Broomfield-Massey has worked as a program evaluation consultant with EMSTAR since 1998. With degrees from the University of Central Florida and Georgia State University, Dr. Broomfield-Massey completed her doctoral work in the field of community psychology with a focus in program evaluation. So she's our uber guru at this. And her work with the Georgia Campaign for Pregnancy Prevention and the Center for Black Women's Wellness sparked an interest in issues around perinatal health. She currently evaluates the Atlanta Healthy Start Initiative, a federally funded program implemented by the Center for Black Women's Wellness, whose goal is to address disparities in perinatal health by removing barriers to adequate health care for pregnant women and also for parenting mothers with infants under the age of 2. Kimberley has done a lot of work around youth development also, and we know her so well because she is an absolutely skilled facilitator and partners with USBC in facilitating the Lactation Support Providers Constellation. So again, we are so glad to have Dr. Massey with us here today, and with that, I'm going to turn it over to you, Kim.
Thank
Kim, you
you so
might be
much,
muted.
Kinkini. Yes, yeah, I was muted. Thank you so much, Kinkini, for that wonderful introduction. Hello, everyone. I'm not used to doing webinars. I'm used to seeing everyone's faces, so this is a new experience. I'm here today to talk to you about the importance of evaluation. And for those of you who are familiar with evaluation, this will likely be like an evaluation 101. This is really just to give you a framework of what evaluation is and to give you some tips on how to start collecting data on a regular basis and to begin to ask yourself questions about the work that you do and find ways to tell the story of your program and show the impact that you're having with moms and babies in your community. And knowing that most of these coalitions or many of the coalitions are volunteer, what I also will be trying to do is to provide low-cost or no-cost ways and ideas of how you can begin to start to create your own databases. And so, as Kinkini said, if you have any questions, please feel free to ask. So I wanted to start off the session by giving some evaluation quotes. And so I've been doing program evaluation for quite some time, and most of my experience has been in the community. And so when you're working, in working with a lot of community-based programs, my frontline staff would see me coming and eyes would roll and people would get really upset, either anxious or angry. Those were the two responses I would get because they felt as though I was coming to judge their work. And in actuality, because my background and my training is in community psychology, I have a very big focus on understanding the work and coming from an asset-based focus. And so I usually start off with these quotes. What gets measured gets done. And if you don't measure results, you can't tell success from failure. If you can't see success, you can't reward it. If you can't reward success, you're probably rewarding failure. If you can't see success, you can't learn from it. If you can't recognize failure, you can't correct it. And if you can't demonstrate results, you can't get the support you need to make a difference. Now, you guys are coalitions, and so you've managed to engage people and generate support. And if you have a way to demonstrate results, then you can turn that support into more tangible or monetary support, which can help you further your effort. And so here's a definition. Here are two definitions of program evaluation. The more sterile definition is that program evaluation is defined as the systematic application of scientific methods to assess the design, implementation, improvement, or outcomes of a program. My definition is carefully collecting information about your program's activities or initiatives to understand and improve your program, and to completely tell the story of your work. So why is this important? Program evaluation is important, not just, well, first, to measure program performance and effectiveness. So if you're engaging in activities, you're going to want to know how effective are you conducting the activities the way you had initially set out to, and is what you're doing effective? You also want to document program accomplishments and impacts. How many times do we have successes and we don't document it? And if you don't document it, how can you disseminate that information to interested others? Program evaluation is also important when it comes to empowering staff, clients, and the community. One thing I would definitely urge all of you on the phone, if you have a number of coalitions that you've worked, a number of organizations in your coalition, as you begin to show people your data, it gets people more engaged and more engaged around the work that you're doing. So it's very important to share your results to staff, with the clients, and the community. Also, program evaluation will help you understand your program processes. It could be that you have some processes that can be replicated because they're so successful, or you have processes that need to be changed because they're not giving you the outcomes that you want to see. Program evaluation can help you improve program implementation. Again, are you meeting your benchmarks? Are you doing what you want to do? And are you seeing what you want to see based on what you're implementing? Program evaluation can also help you improve program effectiveness. And most importantly, and not most importantly, but finally, it can help you to ensure funding and sustainability. So if you're doing good work and you're doing effective work and you can articulate that, then that helps you to become more marketable and makes funders want to provide you with more resources. So right now, I wanted to get you guys to kind of think about, I don't know if you can vote. Can they vote on this interface? Okay, I don't think she heard me. So what I wanted you, can Kenny?
Kim, I'm here, yes.
Yes, I'm sorry. Can they vote on this interface? Like, is there a way that they can maybe type into the chat boxes so
yes,
I can see?
Yes, please do. I wish we had set up a poll for that, but since these are different questions,
no, it's okay.
Could you go ahead and chat your responses? We'd love to hear what your experience with program evaluation has been.
Absolutely. So if anyone has had any experiences with program evaluation, you don't have to answer all of the questions. The thing that I'm most curious about is, did you feel like this was a useful process? So I'm going to give you guys a couple minutes to chat your responses, what you feel about the utility of program evaluation. Okay, well, does anyone have any experiences with program evaluation?
So yes, we are getting our chat responses, and we have many with yes, we had an experience. It seemed to initially slow down the work handing out this survey, but in the long run, it was great. Yes, on experience, we do have a couple who have they have had no experience with program evaluation. And then one, it says it depends on the evaluation. The how you do it, what questions you ask. If it's done well, it can be extremely useful, but sometimes we ask the wrong questions on our projects, and that hasn't been, very fruitful. So good, very good. Whole slew of responses coming in. And one says, my biggest lesson was learning to ask, are we doing the right things, and are we doing them the best way?
Oh, that's amazing. Absolutely. Absolutely. Well, I'm glad to hear that. And for those of you who haven't had any experience with program evaluation, I hope this presentation will be helpful. And for those of you who have had, good or mixed experiences with program evaluation, I hope to help you guys think through some questions if we have some time at the end. My presentation isn't very long. So, great. Here we go. And so the CDC has set up a framework for program evaluation. And I call it the ideal evaluation process because when I work in the community, it doesn't always happen this way. It should, but it doesn't always happen. So I'm going to start with the very first part of the framework, which is engage stakeholders. Engaging stakeholders is so important because it helps to make your evaluation very robust, and it helps you to think of a lot of key variables to measure. And so what's important is to identify and engage key organizations or people that have something to gain or lose from the evaluation. And so it can be those people who are involved in operating the program or initiative. It can be groups served or affected by the program or initiative, or intended users of the evaluation. So when I spoke with Kim Kinney, she said that one common activity conducted by the coalitions is public education and outreach. And so if you think about it in terms of engaging stakeholders, suppose you wanted to perhaps evaluate your outreach efforts. What you would want to do is maybe gather or engage some community members, the community at large, to find out, to get their opinion. You may want to also engage perhaps someone who will fund outreach efforts, because that would be your intended users of the evaluation. You want to also continue to engage your coalition members. So if you have a nice, robust group of people at the table who represent a variety of perspectives, it will help you to really drill down on important questions to ask in your evaluation. And so once you have your stakeholders, the next item to do is to describe your program or develop a logic model. Now, as an evaluator who started doing evaluation in the 1990s, I am a logic model fanatic. I love to develop a logic model because going through a logic modeling process really helps you put on one page all of the ideas you had behind why you developed this initiative or even this coalition. So it helps you to outline the purpose or mission of your coalition or whatever initiative you're engaging in, the context or condition that you're going to address, your resources, and also your barriers to engaging in this, your activities or your interventions, what outputs you expect to see, and what effects or outcomes you expect to see as a result of engaging in those activities. And so what I did was, I don't know how well you can see it, is I put a sample logic model. And so what I'm going to do is I'm going to zoom in so you guys can see a little bit more closely if you're having any issues. And so what you see in the logic model, it usually runs from left to right. I'm going to zoom out for a second so you can see. It usually runs left to right, where on the left it talks about the situation that you're addressing, your needs, what are the problems, who are the stakeholders. And then it allows you to think about what are the resources, what are the inputs that you're putting in to address these issues on your left. So are you investing, what's your investment in time, volunteer hours, any kind of money, any kind of partners that you have, technology, all of that goes in input. Then, as you continue to go over, you think about your output. Who are your participants? Who are you reaching? What activities are you going to be engaging in? Are you going to develop any kind of curricula? Are you going to do community canvassing? Are you going to conduct workshops? Are you going to have to train anyone, any community health workers or any type of person to help do your outreach or your education? All of the activities that you're going to engage in go here, and then your outputs are usually right here. So what are you going to create as a result of these activities? And then as you move further right, you will see your impacts and your outcomes and your impacts. And typically in a logic model, you'll delineate your short-term outcomes, your intermediate outcomes, and your long-term impact. And so in the short term, what do you expect to see as a result of engaging in those activities? That's usually, short term is usually 1 to 2 years. In the intermediate term, usually 3 to 5 years. And then long term is 6+ years. Now this is a rather complicated logic model. This was a logic model example that I got when I was writing a grant recently for one of my clients. Now, the next slide I'm going to show you is a logic model that my colleagues and I helped to develop for a homelessness center here in Atlanta. And this center does a lot of work, but we try to keep it as simple as possible. And if you can see, what we started with on the left is, what do you do? And this homelessness center is the hub for all the chronically homeless people in the city of Atlanta. And so what we had them in our logic modeling session, what we had them to do is to sit down and think through all of the work that they engaged in. So I realized I need to take a step back. When you are developing a logic model, one of the most important things to do is to make sure that your logic model is not developed in a silo. You've engaged all of these important stakeholders who likely will be either a part of your initiative or affected by your initiative. And you've garnered buy-in from them to help you plan and evaluate this initiative. Now you want them to help you to delineate what you'd like to see. And this will create a shared vision for your initiative and for your coalition as a whole. And so logic models can be developed for an initiative. It can be developed for your entire coalition. You can develop it for as large or as minute a program you want. And so now I'm going to go into the logic model example just to kind of give you an idea. Now, the Gateway Center is a very large program, as I said, and they engage in 3 major activities, and within one of the activities, there are sub-activities. So under what we do, they do community engagement, they have client-based services, and they also have programs for residents. And so in this logic modeling session, which actually took about 3 or 4 days, we were able to get key staff and participants and funders in a room to cull down the most important aspects of the program. And so you see, it's a very, very comprehensive services that are provided. And after they talked about each of these services, we didn't have them go into input and outputs, because this was just for them to kind of have an idea and to help guide in their grant writing. What we did have them do is to go into their outcomes. So what we do so that these outcomes occur. So we went in and had them to really call down on what they expected to see from their clients in the short term as a result of being engaged in these activities. what we expected to see in the intermediate term, and what we expected to see in the long term. And as I zoom out, you can see that it was so specific for each of the types of engagement. So community engagement, it goes straight across, and this is a linear fashion. So as a result of engaging the community, they engaged in education of partners and potential partners, collaboration with partners to end homelessness, staff participation in and or leadership in community-wide initiatives. And as a result of those activities, in the short term, the community becomes more aware and knowledgeable about homelessness and related services, and providers are more engaged in assessment and refinement of a service network. In addition, in the intermediate term, the community becomes more engaged and supportive, and the continuum of services is improved. And in the long term, what they expected to see was a community committed to ending homelessness and a continuum of services that was maximized. And so I want you guys, after this webinar, to kind of take your time and look through the two logic model examples that I provided, and really see if you can engage with your stakeholders to try to create a logic model. Maybe not to this extent, but try to really delineate and call out what you expect to see, because it will help you moving forward to really target your efforts. And so the next thing in the CDC framework is to focus your evaluation design. If you decide you want to do an evaluation, you have to identify, what do you want to know? Do you want to know? You want to understand which activities work. So now that you have a logic model, you have explicitly listed all of the activities that you are engaging in. Now you have it on a piece of paper. It's no longer in your mind. It's no longer nebulous. It's very concrete. So now you want to see. You want to understand how they work. Do you want to improve how activities are getting done? Or do you want to determine whether short-term or long-term goals are being met? Are you meeting those goals that you set on that logic model? And so in order to do that, there are multiple types of evaluation. So there's process evaluation. Now, I put performance monitoring because typically performance monitoring will look at process variables, but some performance measures also look at outcome variables and impact variables as well as input variables. So this is just for, a quick and dirty. So if any of you are collecting performance measure data and you wanted to talk about like where it would lie on a logic model, we could. This is just for cursory introduction. And so process evaluation, again, it helps you to look at how your program is running. Are you doing the activities that you said you're going to do in the way you said you were going to do it? And so this accurately reflects your initiatives to stakeholders. It helps you understand whether your activities or initiatives are happening as you plan them to. And when you look at the data and analyze the data, process the data, you can start to address any inefficiencies in the initiative rollout or implementation. Then you might want to do an outcome evaluation so that you can understand any changes in knowledge or attitudes or behaviors that occur as a result of your initiative, or if any of the short-term or intermediate-term outcomes have been accomplished. And finally, you can conduct an impact evaluation, which you can understand longer-term sustained change as a result of the initiative and identify effects on the community and participants that what they would miss out on if they hadn't been in the initiative. And what you can also look at within outcome and impact evaluations both are any unintended consequences. Are there any unintended positive outcomes or unintended negative outcomes that happen as a result of you engaging in a program or initiative? And so next is gather credible evidence. This is the piece that is sometimes difficult when it comes to engaging in activities, because many of us are so focused and doing a good job, an excellent job at implementing the program, that documenting becomes a little bit difficult and cumbersome. And so now that you've determined in your what type of evaluation you want to do and what you want to know, you got to determine, do you want to set benchmarks? So are you saying you want to see a certain number of people? Do you want to see a certain amount of change, and like literally delineate a number or a benchmark that you want to meet? And then you have to think about how you're going to get this information, ensuring that your data has integrity, that it's accurate, and it's sensitive to changes. And so, as I said, what you've got to do in order to gather credible evidence is document, document, document. One thing I always tell my clients, if you didn't write it down, if you didn't record it, it didn't happen. One thing that I've found is I have, for my Healthy Start clients, is my home visiting staff, I meet with them on a weekly basis to have them just take a look at the data so that they can say, oh no, Kim, so if my data says they served 5 people and it's time for me to report, and they know that they went out and visited 10 people, by me reviewing the data with them on a regular basis, they can see gaps in the data and we're able to report with accuracy. But one thing that's really important, again, if you don't record it, write it down somewhere, it didn't happen. And so there are multiple types of data that you can record. Most people find recording quantitative data easiest, because that's the information that can be counted. That's the information you can put in a spreadsheet. So if you're thinking about perhaps evaluating, looking at a process evaluation on your coalition, you can start by collecting data on the number of meetings that you had. You want them to keep data on your attendance records. You want to maybe conduct a survey on the impact or coalition member satisfaction. Or you may want to look at publicly available data on maybe other coalitions or breastfeeding rates in the state to see whether breastfeeding rates have changed as a result of your coalition, since your coalition has been enacted. So there are lots of things that you can do using quantitative data. But another really important source of data is qualitative data. And qualitative data is really, and I have a description of the community experience, but it's really a description of the experience. It's your interviews and your focus group. It's hearing the voice of your client, hearing the voice of your fellow coalition member, hearing the voice, if you're working with hospitals to help them become baby friendly, hearing the voice of the nurses, hearing the voices of the physicians, of the administrators. Is what you're doing efficacious? Is it helpful? Does it seem burdensome? What can we change? All of those things come from qualitative data. What are some of the barriers? What are some of the mitigating factors? So anything related to word is qualitative data, or observation. That's another way that you can collect qualitative data. And so once you've gathered all of your information, then you have to justify conclusions. Under justified conclusions, what you're trying to find out is, so I've collected all these data, I want to know what's going on. What is this data telling me about the initiative that I'm engaging in? So you're going to analyze your data, you're going to interpret your data, and you're going to draw conclusions from your data. Now, another thing that sometimes happens in program evaluation is that the analysis piece and the interpretation piece happens solely by the evaluator or the administrators, and that is not the way to conduct really effectual evaluation. Because once that data is analyzed, you need the engagement of all of the stakeholders to help you interpret the data. Again, working in the community, you can come up, as the evaluator, I can come up with my own estimate of what the problem is. So for example, I use Healthy Star just because I have.
Kim, we lost your audio for a second. Folks, hang on for a second. I
apologize. I'm back. My phone went out. Hello, everyone. I'm sorry.
Right. Welcome back.
Thank you. And so, what was I talking about? Interpreting the data. And so, as the evaluator, I'm removed from the client experience. I'm removed from the home visitor's experience. I'm removed from the staff experience. And so if I look at my data and see that only 50% of our women are having postpartum visits within a 6-week time frame, I'm saying that it looks like these women just don't want to get their postpartum visit. Not that, but when I take the data back to our family support workers and ask them, this is what I've seen in the data, help me to interpret it, it becomes issues around doctors not scheduling prenatal visits, postpartum visits until 8 weeks out. And then at 8 weeks out, mom has to go to work. And so she has to reschedule her prenatal visit. And so sometimes she makes it, 10 weeks after. But if they're not falling within my 6-week scope, then I have to interpret it in a silo. And so all that to say, once you get your data, when you begin to interpret your data, please make sure you have all relevant stakeholders at the table, because you can't adequately interpret your data or draw conclusions from that data unless you hear the voices of the clients, the frontline workers, and everyone involved in the process. When you strongly engage your stakeholders in this process, it ensures that your findings will be meaningful, credible, and accepted by a number of people. And so finally, sorry about that, the last part of the framework is to ensure use and share your lessons learned. That is the step that is most often missed, because most people who have the resources to hire a program evaluator usually do so because they're required to do it for their funder. So they get these evaluators, and as an evaluator, I can cast aspersions upon my field. They get these evaluators who give them these long reports or help them write reports for their funders, but often evaluators are not held accountable to write those findings for multiple audiences. And so if I tell you nothing else today, one other tip I have for you, if you are hiring an evaluator, if you have to work with an evaluator, somewhere in that contract, please delineate that they have to make those findings accessible to everyone. And that way, you're able to not just have these findings and give them back to the person who funded you, which of course you want to do because you want to stay funded, but you also want to give these results back to your staff and congratulate them for the work that they've done and help to find areas for improvement. You also want to give this to your clients to say, hey, look at what you've done. Because of your hard work and the hard work of your peers, here's the impact that we're having in this community. You want to give it to the community at large to say, hey, look at what we're doing. This group, this initiative is an asset. And everyone wants to be affiliated with an asset. And so, like I said, please, if you do your own evaluation or you have an evaluator, find a way to see that information back, whether it's positive, whether it's so-so, even if it's negative, feed it back so that you can get input, so that you can continually improve your program. And so, yes, so once you get your data, you can determine your audience, and then you can use your identified challenges to internally improve your initiative or your program. You can share findings with larger stakeholder groups to promote continued engagement. And then finally, you want to tout your programmatic successes to seek additional partners and also seek funding. Because if what you're doing is successful, people will want to fund you. And so that's the last of my, kind of didactic talk about evaluation. I asked Kenny to send me a list, and she so graciously did, of 3 to 5 activities that most people are engaging in. And so what I wanted to leave you guys with today are some variables that you can begin measuring today. You can do it in a spreadsheet. You can go online and find resources, and also at the end of my presentation, I have some resources that I want you guys to really access, because there are lots of tools out there that you can use that are available at no cost to you that can really help you engage your coalition, engage your community, and engage people around the initiative that you're doing right now. And so, for example, if you're engaging in community education and outreach, today you can start measuring the number of activities that you're engaging in. Even if you can, and all of this you can do in an Excel, you can do in an Excel spreadsheet. You can keep a spreadsheet that has like the name of the activity. So suppose you go to health fairs. Each row can be the name of the health fair you attended, what the date was, what the community was, how many people did you reach at that activity. So what I'm talking about now are the columns. So the first column would be, what is the name of the activity you're engaging in, whether it's a health fair or what type of health fair. Then the next column would be date. What is the date you engaged in it? Then the next column could be how many people attended. Maybe a next column could be, some kind of demographic variable. Because if you're at a health fair all day, you know a rough estimate of who you're serving. Is it primarily Asian American? Is it primarily African American? Is it primarily Caucasian? Are they most primarily women? Are they primarily men? What kind of age groups are they representing? So if you can start to collect little demographics like that, then that helps you to be able to tell your story when you need to. If you want to do a little 2 to 3 question survey about, the education that you're providing, you can do something that says, how useful was this, rated on a scale of 1 to 10. Something quick that won't take people too long to do. And if you have time, you can always do interviews with people, and you can start with interviews with your staff. How useful do you think our education activities are? How useful do you think our outreach activities are? And you can either get someone from the outside to do this, or maybe you give them a protocol and have them do it internally. And, and it's not your staff and your coalition members. Have them rate how efficacious they think your activities are. And that's something that you can do that's anonymous and can help you get to, is what you're doing useful? And so here are some little things that you can begin counting today to help you tell your story. When it comes to educating child care providers on infant feeding strategies, I thought that was amazing. And so again, some little things that you can begin collecting now, and I'm sure you're already collecting in some way, but if you can have it in like one document or a spreadsheet of some kind, how many child care providers did you actually contact? How many were receptive to you coming in? How many were receptive to your instruction? What types of activities did you conduct with each provider? Because maybe some providers gave you 10 minutes, some providers let you stay as long as you needed to. So some way to document what you did with each provider. And then some way to document what is in your litany of activities that you provide with child care providers. Any kind of follow-up survey, maybe a short survey monkey with the child care provider on knowledge, attitudes, and behaviors. Maybe some kind of observation, if you can go back another day and look around to see have things changed. And then finally, maybe you want to do a follow-up survey or interviews with parents. Maybe someone on your coalition knows someone whose kids go to this child care center. That's how you got in the first place. Find out. Anecdotal data is data. Qualitative data is data. And that can help you, again, begin to tell your story. One other example I thought of was supporting hospitals achieve baby-friendly designation. Again, how many hospitals did you contact to provide them with this service? How many were receptive to your support, let you come in? What is in your litany of support that you provide to these hospitals? And then what types of support were provided to each hospital? And then what I thought would be interesting for you to collect, because it would be publicly available data, are the demographics of the women who deliver at each hospital. Hey, if you're able to change this hospital, then you're able to change breastfeeding rates within women of a specific demographic in your community. That's a great story to be able to tell. Did the hospital eventually become baby-friendly? And then, if you have time, to do some kind of surveys or interviews or with hospital staff on the utility of the services that you provide. And so I'm going to skip the next slide because I wanted to show you guys the resources. There are a number of resources available on the internet, free resources that can help you get started with program evaluation. The first one here is the CDC Framework for Program Evaluation. It's kind of high-level stuff, but it's interesting, and this is coming from me as a program evaluator, so take that with a grain of salt. Then there is the Colorado Breastfeeding Logic Model for Community-Based Change. This was an excellent site to go to really have breastfeeding-related evaluation tools. And this will give you an example of a logic model for a breastfeeding coalition. And then there's the Community Toolbox. The Community Toolbox is so wonderful. Any free tool that you want related to evaluation is in this place. You can find anything. And then this one here is one of my favorites. CypherNet Search. If you decide you want to do a logic model and you do not want to pay someone to come in and do your logic model for you, and you have a projector and a computer and you can get your stakeholders in the room, this website will build you a free logic model. All you have to do is put the information in. And then finally, Old Faithful, I call it, is the W.K. Kellogg Foundation Logic Model Development Guide. If you want to do a more in-depth logic model process, I would suggest that you go to this website. And so, do you guys have any questions?
Thank you, Kim. That was terrific. And we do have some questions here, as always. There's just so much to learn from you. And for folks who are handling multiple projects, as the ways to get through, coalition, getting a logic model done, and an in-depth evaluation is such an important piece of just recognizing all the different elements at play at coalition and why something happens. For coalitions that are handling multiple projects sometimes and might want to do an in-depth evaluation while they're embarking on it, we do a lot of performance measures, which are quick ways in which to kind of integrate continuous monitoring and QI into our projects. So would you be able to kind of just tell us a little bit of difference between the program evaluation and then the, performance monitoring?
Oh, sure. So when I think about the difference between program evaluation and performance monitoring, I think of performance monitoring as collecting the data in buckets so that you can get a snapshot of what's happening. And then I think of evaluation as connecting those dots. And so for performance measures, you typically have to measure things in terms of benchmarks. So how many community breastfeeding support groups did you establish? How many women in your community initiated breastfeeding? So those would be your performance measures, just quick snapshots, but they don't really tell the story. An evaluation would be, okay, yes, how many people initiated breastfeeding, but among those who didn't initiate breastfeeding, what were some barriers? What were some deterrents to that initiation of breastfeeding? Or using the example of breastfeeding support groups, yes, you have, 60% of your sites established breastfeeding support groups, but for those, so what helped in the development of those support groups, but also what were some barriers to developing those support groups? So an evaluation will connect the dots of the performance measures. And many times, performance measure data is used in program evaluation, but usually it's multiple buckets are used to conduct analyses to tell the story.
Great, thank you. And for many of our folks who do multiple projects, that there are monthly reporting that grantees have to do, and sometimes it's semi-annually. And some of those are easy, things just like you said, measurements. How many women achieved any breastfeeding at 3 months, exclusive breastfeeding at 3 months? How many achieved any breastfeeding at 6 months, or exclusive at 6 months? How many support groups were conducted, and how many people entered? Just like as you said, but periodically for coalitions to engage in an in-depth evaluation is just such a critical part of building the coalition. And the other thing that often, another question is that most people are in the mindset of thinking about evaluation unless there's very, rigid guidelines of thinking about evaluation after they've created the work plan. So when is a good time to be thinking evaluation?
Oh, evaluation is, I always think of evaluation should begin before the beginning. Actually, that's what I was taught. Evaluation should begin, planning your evaluation should happen simultaneously to planning your program. That's an ideal situation. And implementing your evaluation should begin, ideally, with the implementation of your program for a number of reasons. So one thing I wanted to tell you, when you develop your evaluations, those are static, but your variables, you'll never think of all of the questions ahead of time. So you've got to understand that sometimes your evaluation will give you information on things that you hadn't planned. But if you begin your evaluation at the beginning, so if you start, ideally you would start with the logic model. This is what I want to see. And then with your logic model, you can begin to think of how are you going to measure each of these activities. Before the pressure of implementation, you can start to think about what would that look like. If you say you're going to set up one of your activities is going to be attending a health fair, then who's going to capture that? Where's that going to exist? How do you even define attending a health fair? Does that mean you have a table and you leave flyers on a table and nobody is manning it? So when you are building out your program, that's the best time to begin to think of your evaluation. Now, that's not always possible, but ideally you want to begin your evaluation as you begin to plan your program or your initiative.
Great, thank you. And then there's we have a question from Jessica Armstrong who asks, what are some good ways to collect data when you have multiple community partners? Do you do paper form data via, other databases or online, with your experience?
Well, it all depends on the resources. So if you're a highly resourced coalition with multiple partners, then I would suggest getting a customizable database that is online. But if you're not, so I usually start bare bones because most of my clients don't have much funding to start with. But I will do what I encourage them to do is start with the resources you already have. Google Docs are amazing. Google Sheets are wonderful. Spreadsheets with multiple tabs. And so you let people know this is what belongs to you, this is what belongs to me. I would encourage people to use Dropbox and give people access to various files in Dropbox. So for example, if you're working with multiple community partners and you want them all to collect the same data, as I said, ideally you may want one system, but if you can't afford that, then you develop one spreadsheet that enables them to capture the data you need. You can either give them their own folder in a Dropbox folder and you aggregate that data. That way they're not, so I'm funny about my data. I like the data clean. I don't like anybody else, typing into my spreadsheets. So I would give them their own spreadsheet and then aggregate everything into one spreadsheet that you hold. And now the other issue then becomes accountability and how do you get people to put the information in the system. And, that's a whole nother animal right there. But I would suggest that you start with using the free tools. I'm really familiar with a system called ETO, Efforts to Outcomes. I like that. But I've also worked in other systems. But if you are going to invest, those systems are pretty costly. If you are going to invest in a system, I would encourage you to get one that is customizable and customizable by you, not something that you have to go to a programmer every time you'd have to update something. That becomes extremely tedious. It's so time consuming and it makes your database not flexible enough for you to be able to adjust to your community's needs. So I would also encourage you to get a web-based database. If you're going to invest in a database, get something that's web-based. So you don't have to be on somebody's server. You can be anywhere. A lot of these databases you can access using your smartphone or your tablet. The easier it is for people to access that database, the more likely it will be for them to use it.
Great. Thank you, Kim. And we have a lot of folks saying thank you for this. Very useful, and we're going to tell you again that the slides are available on the Power Tools page on the US Breastfeeding website. So you do go to www.usbreastfeeding.org/powertools, or you can just click on that coalition tab and you'll have a drop-down menu. So we don't have any more questions. We do have some time, Kim, so if there's anything else specifically that you felt that you could not give enough time to, this might be a good time to do it. We have about a few minutes more.
Okay, well, here is one thing that and this is my pet project, not something that I do for a job, just something that another evaluator and I have been thinking about and ruminating about over the past few months. We have very crudely named it the Breastfeeding Support Provider Needs Assessment Survey. And so it's been our experience that different breastfeeding support providers or lactation support providers have varying capacity as relates to evaluation, as relates to performance measurement, as relates to just being able to systematically capture their data. And it made us pretty curious. And so what we wanted to do was to ensure that all breastfeeding support providers or lactation support providers can conduct evaluations if they wanted to. And we also felt like there's certain benchmarks or certain data points that every breastfeeding support provider should be measuring just to show that they are making an impact in what they do. And so, again, I've been in collaboration with two colleagues in Wisconsin to really try to assess the evaluation needs of lactation support providers within the United States. And we came up with a survey a while ago, and we wanted to kind of get some feedback from people about the survey, whether it was too long, whether it asked the right questions, things of that nature. So one thing I wanted to do is kind of get the sense from this group, if possible, about the evaluation capacity of the variety of breastfeeding support providers or lactation support providers, and also to find out if anyone on the call would be willing to take a look at the survey to see, you know, whether it would be a useful survey for us to engage in. Because I think in the long term, what we were thinking about doing is perhaps developing some kind of toolkit to make publicly available for breastfeeding support providers everywhere. Just, you know, again, Evaluation 101. Here are some easy things that you guys can do to just get you started. Even if you only see 5 clients, you know, a year. Here are some basic things that you should be looking at, thinking about, collecting, and asking yourself as you're working with your clients related to evaluation. So again, 2 questions I guess I put out there. One was, what do you know about the variety of experiences for breastfeeding support providers around evaluation? And would you be willing to look at this tool to kind of give us your feedback?
Wow, what a great plan, Kim, and such a good service to the field it'll be if this happens for, you know, when you are able to do this. So, folks, please chat us if you would be willing to review this survey and provide feedback. And your first question was, what is out there?
Yeah, what is out there? Yeah. What do you guys know? Because especially with you guys being coalitions, you have, you know, your reach. You have reach to a variety of lactation support providers. So you would know, like, are a lot of people really skilled when it comes to evaluation? Is there a need for a toolkit? Like, are we just creating another project that we don't need to create?
Absolutely. Great. So we are getting a lot of yeses, Kim, and thank you, folks, for being willing to do this. So, you know, this will be a good value to the field, and we'll pass your contact information along to Kimberley Broomfield-Massey, and so she can contact you. Well, wonderful. And yes, more yeses coming in.
Oh, great. Thanks, guys. Thanks. I appreciate that.
So
that's awesome.
I do have one more question.
Oh, absolutely.
Okay, so what did Kimberley mean at the beginning when she said that her staff would cringe when they saw her coming because she didn't understand she was coming from an asset-based perspective?
That you're coming from an asset-based perspective. They assume that you're coming in to judge them and to tell them that they're doing an awful job, and make them do all these things that they really don't have time to do, because what's most important for them is going out and seeing their clients. And so as an evaluator, and, you know, gratefully, you know, coming from a community psychology perspective, I had to do a lot to gain buy-in from my staff. I mean, because a lot of, so my very first client, they didn't have an automated system at all. Everything they did was paper pencil. They didn't collect anything electronically because it was something that was just foreign to them. The caseworkers, they wanted to go out, they were hired because they were good at what they did. They were not hired because they were technological experts, and they were not hired because they did well in Excel. And so what I had to learn how to do is to really meet everyone where they are. And so there was fear and trepidation around evaluation and what I was going to do, and was I going to get them fired, and was I going to get them in trouble, and maybe they weren't meeting their goals, and, you know, all of those things. And so I had to really get to know the culture of the organization, get to know the frontline staff on a one-to-one basis, on a human level. And for some people, it was that they were intimidated by having to work in a data system. So what I would do is set up like Saturday sessions and teach people how to use Excel on my own time. Because if they didn't know how to use the Excel database, because I had to start incrementally, I couldn't take them from, well, the center didn't have enough money at the time to go from, you know, paper pencil directly into an online system. And so, you know, take them through, how do you use Excel? What does it mean to enter data in on a regular basis? And so letting them develop a level of comfort around the data. And that's why I say sharing the data is so important, because when I was able to aggregate the data from 6 different staff members and tell them, you know, among yourself, you conducted 200 visits, you know, this month, and served 50 clients, and had 3 births, and none were low birth weight, and all initiated breastfeeding. I mean, that gave them a sense of purpose and, you know, a sense of deeper engagement, wanting to show. So now you can tell that what we do is making a difference. And so it took a minute to gain that buy-in, but once I did, I had people who were totally engaged in the data collection process and the data reporting process, to the point that, you know, on a monthly basis, if I didn't have my monthly report done on time, it was like, you know, Kim, I didn't get my monthly report. I need to see what's going on. And so that way, the administrative staff was happy, because you had your frontline staff who was engaged and wanted to know what the numbers were. Did we meet our benchmarks? Look, see, now you can see how much work I do. That was what the staff, I call them my staff now, but they're not my staff. But my staff would, you know, say to me. And so now I can show my supervisor all the work that I do, because now they collected it in a systematic way.
Fabulous. And I can't tell you, as Danae and I speak to coalition leaders and coalition members, we are just like, our mind boggles at the amount of work that they do. Like, it's just, yes, for mostly volunteer-run organizations, they're just doing an amazing array of activities, and sometimes even their websites don't give really an indication of just how prolific they are in the community, how much their reach is. So collecting data, absolutely. And for the coalitions listening, please go to the USBC if you, and get your community admin, your group profile set up, because that's just such a great way to know, again, on the different action, the work that you're doing. But that also tells, so while you're doing the evaluation and things, it gives you like a list of all the activities you have. Sometimes I think even having really listing what coalitions are doing is hard to come by, because there's just so many members doing so many things. So absolutely. We have one question which says that, you know, we want to be sure that we collect data and that the data is really has good integrity and fidelity, and so we want to ask questions in different ways. But how do we streamline the process and to reduce the burden on our recipients, keep our questions to the minimum? So, you know, that fine line of optimal strategy. Is there anything you can speak about that?
That's where engaging your stakeholders is important, because if you hear, so in reducing the burden to your clients, I understand that, and I err on the side of sometimes collecting too much. And so that's when I do engage my clients. And I call them my clients, but yeah, with the client voice. And here, and I literally will give them a survey or give them an intake sheet and tell them what I'm trying to collect and say, when you read that, am I getting to what I want? What are other ways that I can ask it? What's an easier way to ask it? So I would encourage you to use that step of engaging your stakeholders. Engage your staff. Your staff knows the clients that they work with. Sometimes administrators forget the wisdom, and not that you forget, but don't overlook the wisdom of your staff. And they'll be the first to tell you if it's too much. And they may, and if you engage them, they may help you to tweak and tool your measures. And I don't know if that was helpful, but that's typically what I will do. If I get to a point where I feel like I'm measuring too much, then I sit down. I have an evaluation work group that is comprised of clients and staff and administrators who help me. And they say, no, Kim, this is too much. Or yes, or sometimes they say, no, we want you to look at this.
Terrific, great. Really listen to your stakeholders. So, I think that's the time that we have. And thank you again, Kimberly, for such a terrific presentation. And that brings us to the end of today's session. Thank you for all you do to improve the lives of women, children, and families. And we do please complete our survey feedback because we do read them and we are in service here to you to build your coalition capacity too. So give us some ideas about what you'd like to see in the Power Tool series. And then don't forget, next Tuesday, November 24th is our next webinar in the Racial Equity series. So it'll be good and I hope you all can join us then. So thank you again to Dr. Broomfield-Massey for a wonderful session, and thank you to you all for attending. Until next time, bye-bye.